As a clinical social worker, our job really is to look at that person in their entire social environment. We are educated to think about people and in their psychological makeup, but also to really pay attention to how they function in their families, how they function in social groups, how they function in society as a whole. Their religious or spiritual context is an important part of how that individual functions within their society and how they are affected by that religious spiritual context as an individual. Social workers tend to be very good at establishing rapport and in some sense eliciting that story and that narrative from a patient. There are things that in a clinical context, and especially in today's fast-paced medical environment, that other clinicians may not have the time to elicit as much of that story and potentially may miss some aspects of that story that are going to be important in the care of that patient. What I do enjoy about the work that I do now is the way that you have that privilege of being invited into the story of a patient. You become a part of their story to an extent, not necessarily in that you're the one writing the story, but you get to participate in some small way and maybe help shape that narrative. There are times as you're working with a patient that assisting them in seeing the ways that their own narrative or story can change is an important role that you have in your work with a patient. Oftentimes people do begin to, in effect, write their story in a particular way, but it's in a way that's very limiting for them and very limiting for their health outcomes. So part of your role would be to help them see that there are other possibilities in this story, other ways that the narrative could change and develop.